Hi guys, welcome to our YouTube channel. So now here we will come back with the part 2 of the United States healthcare services. So in this video we will discuss about the RAND health insurance experiment. We will see about how the cost, the fracture and the many other procedures and the circumstances. So let's start. The RAND health insurance experiment. And do cost influences the utilization of healthcare services? And if so, what is its impact? Many argue that since healthcare is unique and unlike other goods individuals consume, financial incentives do not influence healthcare consumption. However, the data from 1970s RAND health insurance experiment demonstrate that the economic incentives in terms of insurance are important in the utilization of the health services. Higher prices will decrease the demand for care. While these findings are logical, there is evidence that demand and access to care are influenced by the variety of other factors. The RAND health insurance experiment, the RAND HIE, was a randomized experiment that assigned 5809 people from about 2000 households to different insurance groups with varying cost-sharing schedules between the year of 1974 and 1981. Furthermore, the sample included the individuals from the 6 different locations in the United States, and the adult participants were under the age of 62. The families participating in the experiment were assigned to one of the 6 possible coinsurance rates, and they were randomly assigned to varying out-of-pocket maximums within the 6th plan. The assignment of the participants to the insurance plan was not simple random assignment. Instead, a stratified random assignment was used along with the finite selection model to maximize sample variations while satisfying the budget constraints of the experiment. In the next paragraph, we will discuss the purpose of the RAND HIE was to document the relationship between insurance and the use of health services for the non-elderly population, as well as the effect on the patient outcomes. The RAND HIE results showed that if the patient had a greater liability for healthcare services, meaning the patient needed to pay more to consume those health services, then their health expenditures decreased significantly. In other words, the patient utilized less services when out-of-pocket costs are higher. The results of the experiment were that if the cost sharing was increased, then the use of physicians, hospitals, and the prescription services was also reduced. The other major finding of the experiment include that the cost sharing did not significantly impact the quality of care that the participants received. Additionally, while cost sharing did not adversely influence the health outcomes of participants, the study and documented that free care improved hypertension, dental, and the vision health, and the specific symptoms affecting the sickness and the poorest patients of the sample. Even though the improvement of the health outcomes was limited, of the three main categories mentioned, the results are relevant. For insurance, the indirect cost due to dental disease in 2010 was estimated to have a global impact of $442 billion. Dental diseases alone had such a profound financial impact. Therefore, any improvement in the health can possibly have a financial benefit down the line. And the RAND HIE's experimental design helps control for potential confounding variables by assigning individuals to the specific insurance groups and provides an effective analysis of how insurance coverage impacts the utilization of services. In that, other studies with a non-experimental design are not able to control for or reduce the influence of adverse selection. In healthcare, adverse selection is the process where those who are insured will decide whether or not to purchase the insurance using the private knowledge of their personal health risks. Adverse selection and risk in the broader insurance market can also be tied to the concept of moral hazard, which is heavily related to the health insurance and the demand for the health services. There exists a trade-off between the societal benefits of the health insurance, lowering the risk for consumers, and the financial losses caused by increase the demand for the healthcare services one insured. Whereas the trade-off concerning moral hazard implies that as the out-of-pocket cost patients pay decrease, the demand for the medical care increases. The certain medical services are very expensive, and thus the consumers would normally not purchase additional care if they had to carry the full burden of the cost. The participants of the RAND HIE could not choose their policies. So, the study controlled for moral hazard. Therefore, the RAND HIE results of reduction in the expenditures might be as a result of the adverse selection. Healthy people picking policies with a higher co-payments. And the next topic and the next detail we will discuss in our next video. So, goodbye. Tata.